I'm Stephanie from Positive Connection Dog Training, and I am joined by Dr. Laura, and I'll let her introduce herself here.
Dr. Laura Talega. I have been a veterinarian for 6 years, and my passion is shelter medicine. So I'm not necessarily your average general practitioner, but we're basically in the dredges of the big question of spaying and neutering and overpopulation and what that means. So,
And we're sitting here out on the lovely deck, so we should start.
Toast.
Perfect. Let's get this blog started off right. So the discussion today is going to be surrounded around spaying and neutering your pet. Oftentimes I get clients in or phone calls about when they should spay or neuter, or should they or shouldn't they, the pros and cons. And so I thought it would be really informational for all of us to hear facts from someone who does this day in and day out, to get actual facts and not what my friend at the feed store said, or what my sister said, or what my trainer said. I want to get facts, cold hard facts about when is the right time to spay and neuter your dog, and what are the effects, or what is to be expected, and so on and so forth. So we got a list of questions together, some of the most commonly asked questions, and we're just going to go down the list and kind of answer some of these for you. Although please feel free that after you watch this blog, if you have any questions, comments, or concerns, to go ahead and put those in the comments here. So let's see. So we'll get started. One of the questions that I was asked just earlier this last week is if a female should go through one heat cycle before being spayed, or is it okay to spay her before the heat cycle? Why or why not?
Why or why not?
Yeah.
Exactly. So females and males generally come into sexual prime anywhere between 5 and 8 months. Dogs, of course, come into heat. The females come into heat about 2 to 3 times a year. Not all the time like cats. Not every month like humans. And so that can be relative to time period, right? So if it's in the middle of the winter, she's going to hold off till spring. So one of the biggest...
Who likes to give birth in the winter?
Who likes to
Nobody.
give birth in the winter, right? So breast cancer is the top reason to consider letting them go through a first heat versus not. And the reality is, breast cancer is very common in intact female dogs. Much more common than in humans. Up to 10 times as common or something like that.
Oh wow,
yeah,
that's
I mean,
quite a bit.
It's a big deal. Now, it's not necessarily quite as aggressive as it can potentially be in humans, but it's not a big deal, okay? And so I think, breast cancer is something that we hear a lot in our human society, and you don't necessarily hear about it with your dog. But it is a really, really real advantage to spaying them before their first heat. And of course, we're going to talk about the consequences of doing that. But that's one of the biggest advantages. If you spay her before her first heat, it is literally zero, it's like 0.001% chance that she will get breast cancer. And every heat cycle after that, it increases significantly to the point where you hit 3rd, 4th heat cycle, basically damage is done to that mammary tissue. And so that is hands down one of the biggest reasons to catch them before their first heat, other than unwanted pregnancies, and we can talk about that.
Yeah, I didn't know that it increased exponentially the chances of getting breast cancer every heat cycle. That is incredible.
And once you hit that 4th heat cycle, it basically doesn't get any higher than that. You're at the mother load. Damage is already done to the mammary tissue, and if that's a concern for you, then that's a real factor.
Okay. And so then basically there's this myth about letting your dog have the 1 heat cycle or have 1 litter of puppies.
That's a huge wives' tale.
Yeah.
So absolutely. I mean, the reality is, anytime you have an intact female dog, there is something called a pyometra that can happen to them. To my knowledge, this doesn't happen in humans, but anytime they go through a heat cycle, that cervix opens up, and if bacteria enter into the uterus,
Okay, yeah.
okay, you end up with real issues, talking life-threatening issues. I would much rather spay a dog when she's, healthy, whether she's a healthy 7-month-old or a healthy 10-year-old, okay, versus that emergency clinic, trip and that $2,000 surgery, whatever, of a septic dog because her uterus is literally filled with pus, and can rupture in her abdomen. And I've actually seen a 7-month-old dog, first heat cycle, closed pio. That dog would have died if we didn't happen to be spaying her. Actually, it was an accident. She just happened to be scheduled.
Oh my goodness.
Totally. No real signs quite yet. Oh yeah, she's not feeling quite right. Didn't have a fever yet. Oh, she probably just ate something, right? Nope, this dog's uterus was massive. They would have.
And you said that's 7 months. That's at the first heat cycle.
That was literally her first heat cycle. So we always talk about it as, the older they get, the more likely it is to happen, and that's totally true. Anytime you have
the whole,
and the reality is, anytime you have a dog that you're not going to intentionally breed, this is again one of those real emergency. It's pretty common. We're going to talk a lot about what's actually common, not just a fearful thing that's super scary that only happens to a few. And that perspective is massive in making these decisions. We're all afraid of flying, but the most dangerous part is driving to the airport, right? And so that comes into play.
Right. What is actually
something
what is
that
actual?
We see on a regular basis that if you should consider trying to avoid versus that thing that could possibly happen.
Okay, so piggybacking on that, so you said it's a 7-month-old. So when is the right time or recommended time to spay or neuter your dog? And of course, we're mostly so far we've been talking about the spaying and some of the effects, for females. But so I have a puppy right now. So
Totally.
When should I be bringing her in to get her spayed?
Exactly. So first of all, I do want to say, if you have a veterinarian that you trust, that you have a good relationship with, I always recommend ask them first, because there's a lot of professions out there, right? Dog training's one of them. You ask 10 different people the same question and you will get 10 slightly different answers, and it has to do with how much time do we have, right? And that's where this is super cool, because I never actually get this amount of time to discuss the answer with a client.
Right.
I have to give them my opinion and a few reasons why I'm encouraging you to do so. Well, you may have different concerns, and so if you have a veterinarian that you really like, ask them.
Absolutely.
Ask the questions that are concerning you, and just move on from there. Like I said, my background comes from animal shelter. My chief concern is overpopulation. I work with rescues. I work with, puppies that we're having difficulty placing, highly adoptables, because we have too many animals. So it's more of a herd health answer versus an individual. So males, females, very different. And I'll give you my quick spiel when somebody asks me.
Okay.
Right?
Yep.
So,
because I am an actual client. My puppy will actually be coming to her.
Yes.
So this is my trusted source.
So, females. One of the biggest advantages to doing it earlier, we already talked about it. Mammary tumors, breast cancer, okay? And if it's a small breed dog, you're really not talking about these osteosarcomas,
And what is that?
Osteosarcoma, it's a bone tumor.
Oh, okay.
Yep, it's a pretty painful terminal. Diagnosed osteocarc is, survival time 1 to 5 months, but it really is terminal. That's what kills them. If you have a dog with osteosarc, that's what kills them, and there's not a whole lot of options, of course. Very, very unusual to catch it before being able to, basically take their leg off, do enough, chemo, all those things, okay? So that's a big, scary thing, right? And it's not terribly uncommon, to be totally honest. It is worth a discussion, for sure. So your smaller breed dogs, you're not really worried about a lot of those huge growth things that we're seeing. And so for those little guys, I recommend catch them before their first heat. So you're looking at 5 to 7 months. And 5 months always comes sooner than you think.
Oh, man.
Okay? So 4 months, their adult teeth are just starting to come in. 5 months, you swear they're still a puppy.
Yeah.
Okay?
They're
And you know what I
babies.
say? 14-year-old humans, 12-year-old humans get pregnant,
Get pregnant.
right? We forget that
Yeah.
humans can actually have babies when they're 12.
Right.
Okay? You know, our society, of course, has made that later and later,
Yep,
but
yep.
guess what? A 5-month-old puppy can come into heat and, of course, should not be getting pregnant, but they can. And so that's it'll come before you know it. So, vaccinations every 3 to 4 weeks, up to 4 months old, get your rabies, look at your calendar 1 to 2 months out, make your appointment, because life is going to get in the way.
Yeah. And that's
And then
just
she's
it. I
gonna
think
come
it's
into
that
heat,
scheduling.
and then-
you schedule the vaccinations and you schedule the spay or neuter appointment.
Yeah.
It keeps you on track,
Yeah.
and it's out of sight, out of mind. You'll get that reminder on your phone. Boom, you need to make that appointment.
And if
Yeah.
something comes up, it's easier to cancel it and reschedule it
Yeah.
than to remember.
Then try to remember. Yeah, absolutely.
And it happens all the time. She just came into heat. I forgot about it. I was going to do it. Can we get her in right now?
Mhm.
And nobody can schedule a day or two out. And we can also talk about risks of fixing them while they're in heat, etc. I think we're going to talk about that. So,
yeah.
but to finish your question, so small dog, definitely get them before their first heat. Large dog, and by large dog I actually mean like Mastiff, Rottweiler, Golden Retriever, not your little pitty mix. Your little
not
pitty
your
mix
medium
who's
size.
gonna be,
Yeah.
50 pounds, no big
Yeah,
deal. Okay?
yeah.
I really I take the Great
Large.
Danes. Yeah, I take the Great Danes seriously. That's a lot of growth. That one is a little bit more your choice. The spay neuter shelter side of me wants to say, get her before her first heat, right? Any breeder you talk to, anybody who really values that longevity factor is gonna say, if you can make it to a year, get to a year. And basically it's the lesser of two evils. So that's that. Male dogs. Really? It's go as long as you can until you get naughty boy behaviors and then snip.
Ooh, yeah.
So,
Yeah.
I mean, there's definitely evidence out there. The big guys, the Rotties, you really should give them quite a bit of growth before you neuter them. But I deal with, scraps, right? If there's a dog running down the middle of the road and it's a boy dog, is it neutered?
No.
It's intact. And so really, we're thinking, when he's old, he's gonna get hemangiosarcoma. He's running down the middle of the road, he's gonna
Yeah,
get
he's
killed
gonna
by
hit
a
the
car.
car. That's what you should be worried about first.
That's what you should
Yeah,
be worried
uh-huh.
about. And
Yeah.
everybody is, but I have a fenced-in yard, and I'm very, he's always with me. Nature's nature. There's no such thing as your dog knowing better. And when there's a girl down the road, they're gonna all of a sudden want to get out of that yard. Or if you have a female in your yard, they'll get in your yard.
They'll get in your
If
Which is exactly what happened. So anybody who's been following the page knows of Annie and the A-Team. So Annie, her family moved away and left her.
Yeah.
So she was in the backyard, fully fenced backyard. She never got out of her yard.
Yeah.
Somebody came into the
Into
yard.
her yard.
Her milkshake brought the boys to the yard. And lo and behold, we have the 18 puppies. So if you're going to be making that choice of being exceptionally responsible, if you're going to make the choice of waiting, being very responsible about where your dog is at all times, knowing that she can get pregnant or he can impregnate, and setting up those boundaries. Don't go with the, my dog wouldn't do that business. Oh, yes, they will.
Yes.
Again, it's not a behavioral thing. It's very much in their DNA. It is natural for them to do this. And so you're going against nature, but you have to put up those boundaries if you're going to wait. And be diligent and let the whole family know. The gate cannot be left open. The whole family must know. But I can get on that soapbox. Stay on there for a long time. Okay, so That goes into, so Annie had her puppies. How long should she wait until she gets spayed?
Good question.
So she was nursing, like
Exactly.
if you're nursing mama, like how
Yep.
long do I need to wait for her?
Yep, absolutely. So puppies, puppies leave about 8-10 weeks. A lot of people will try to pull them sooner, right? It seems like they need to go sooner. Please let them
there's
leave.
so much poop.
Right, there's so much poop. They start to hurt, their teeth are there, and so they start to actually damage those mammaries. And then there's this point where, okay, so you pull the pups and they're not nursing. Well, she's going to bag up just a little bit, right?
Yep.
And so that's that moment where I'd really rather not, right? So again, with the planning of, yes, pull the puppies, but then don't just plan, to get her spayed the week later.
Yeah.
Maybe 2 or 3 weeks. Let her dry up just a little bit. And again, that post-op period of checking the incision, keeping her e-collar on if it's recommended, which is always
recommended.
Recommended, so they don't lick. It's weird. It bugs them. It's not that it necessarily hurts, but it's uncomfortable. If you've ever had surgery, it's weird.
Yeah.
And so they're like, hey, this is weird.
And isn't there something to be said for everything is pretty inflamed still?
Yes.
Like, so if you go in to do the surgery, if we wait a little bit longer, it reduces the bleeding and
it gives a chance for all the
everything
tissues
just to
to really
calm
just
down.
calm down and not be so.
The labor, that's a lot of trauma, and so it just makes everything
Blood
a little
vessels.
bit blood vessels, and so so just waiting until she's totally dry, and what about? Are there any other signs? Because after mothers have babies, there's a discharge for a while.
And that's really just the uterus sorting itself out. There can be discharge for quite some time.
So would it be a sign that once that's gone, that would be a good time then to follow through?
Yep.
So kind of waiting for her to dry up, waiting for no more ick, no more discharge, and that kind of thing, and then start thinking about making your appointment
and
a few weeks out.
That's the most ideal situation. I do, I work with rescues. And so we're hoping to place these dogs. And so we get a lot of experience with not waiting that ideal period. Again, if you have a vet that you trust, ask them. Or if you, depending on what life throws at you, I've seen everything from I need to move, right? It's not the end of the world to spay her while she's nursing pups. It's really not the end of the world. But you asked ideal? So that would be ideal.
Sure. Okay. This one is the most common thing that I hear, and I have a feeling that maybe you hear it too. I looked also on the internet of what some of the most commonly asked questions were, and this was bing, numero uno. So will my dog's behavior change after they've been altered? And the fear of doing so, it might prevent people from doing it because they're scared their dog's behavior is going to change.
Okay.
Let's touch on that a little bit.
Totally. And you see this a lot, right? Working dog round, right? There are, they get better drive if they're intact. My, voice in my head goes, yes, better drive towards that female walking down the road.
Right.
So I think there's a big difference between, personality and behavior, and just picking that apart just a little bit, right? Because the personality of your dog, that's not going to change.
Exactly.
Like at all.
Did you hear that? The personality of your
Yes,
dog
the
will
actual
not change.
The actual personality of your dog will not change. In fact, I would argue that this changes that you may see, okay, and I never promise, is it going to stop marking? Well, this is a step in the right direction.
Okay.
I would never promise that, but this will certainly not, hurt your goal, okay? This is a perfect first step. They're not going to be quite so about themselves, but a dog is a dog. A dog will protect you. In fact, I would argue that they're more ready to protect you because they're less distracted. So, they might be less amped, right? In terms of reactive. Well, that's a good thing, right? But trust me.
Here's another question that many people ask: will my dog stop protecting the house if I get him neutered or her spay?
Yep.
The answer is no.
They will protect you.
No,
It
there's
has
no
nothing to do.
scientific evidence that says your dog will just go, oh, I don't care.
Yeah.
Now what happens? I have no testicles anymore, so come on in. Here's where the china is. There's no scientific evidence around that, as far as I know.
Not at all.
So you don't need to be concerned about that. If they're going to protect, they're going to continue to protect. That is something other than their instinct to reproduce.
Yes.
To separate issues.
Separate issues.
Yeah.
Now that arousal, I mean, a lot of people, they like that arousal to ward people off.
Mm-hmm.
Sorry, that's not just going to go away.
Right.
Your dog is not going to turn into a couch potato.
Yeah. Speaking of couch potato, another concern is also if they're going to be gaining weight. They're worried that that's going to change.
And that is completely in your power. You have complete
Control over the food that they get.
You have complete control over the food that they get. So let's just think about this for 2 seconds, right? They're intact, right? So females, yes, they only cycle 2-3 times a year, but those hormones, you know, I mean, they're ready, they're looking, they're whatever, you know. Males, gosh, they're going all the time, right? They are.
Hello.
Every day he wakes up and tells himself, "Am I going to get?
You get my sperm, and you get my sperm, and you get my sperm." Yeah.
So in a way, it makes sense if we take that drive, that hormonal drive, away from them. Well, they're not going to be quite as active. Now that has nothing to do with like ball drive and work drive. That's sex drive. We're just taking their sex drive, right?
Right.
And so, yeah, they might not be burning as many calories. Just like the whole, oh, well, in the winter we don't go for as many walks, so they balloon up. Well, guess what? You have the power to anticipate that. So, yes, if they gain weight, right, or even anticipate that they're going to gain a little weight, anticipate the fact that they simply don't need as many calories now because their metabolism isn't quite revved up all the time. And so, sorry, but that's the owner, not the dog. You know, the dog doesn't know when to stop eating. If I didn't know any better, I'd have ice cream and beer every night at 10 o'clock.
Right. Yeah, exactly.
Probably in that order. You know, I mean, we are aware of these things like self-control, and dogs are not. You know, I mean, yes, some dogs do fine free-fed, but if your dog was fine free-fed and you fix them, watch out for that. Just be aware.
Yeah, absolutely.
I want to see ribs. I want to see ribs as they walk, and we can. I think we'll talk about them being overweight.
Overweight is a totally separate. Yeah,
it's like a wholly separate.
Oh my
thing.
gosh,
Like,
yeah, that'll be another blog post. We'll talk about weight on dogs because that is definitely an issue, and among humans as well. So it goes across the board. Okay, so we have a little bird talking to us. Yeah, hi. Okay, so another one is will neutering my male stop him from marking?
Good question. Not necessarily.
Bingo.
Just maybe with not as much gusto, and that's exactly, I tell people, I never promise, right? So a behavior starts off with a purpose. If you take away that cause, if they've been doing it for a while, it's a habit. You don't need that. You don't need that reason anymore. And of course, different dogs are different personalities, right?
Sure.
So, you know, marking, you know, out on a walk, out in the yard, of course they're still going to, you know, protect their family, their property, they're going to mark things.
Fine.
If you have a dog marking inside, get on that. Fixing them is going to be and that's where the naughty boy behaviors come in, right? So some dogs start being naughty at 6 months. Like, sorry, I can't let you just practice this for 6 months until we get to a year, and then think that we can backtrack.
It's hard to stop.
It's
already
the
neuter
habit
alone. Yeah, the habit has already been instilled.
I mean,
it's a behavior now.
Yeah.
And so you would have to train them out of that. The neuter alone, if it's pretty ingrained, in my opinion, that's not going to fix it. It might help some, but the habit is still there, and that did not go away with the neuter.
Right.
So,
but neutering them is the easiest way to stop it from ever starting.
Yeah, because they never, they never had the opportunity. They don't even know that they can. And so I am very much in favor of neutering the boys early so that doesn't start. However, most of the dogs that I deal with are going to be your average medium-sized dogs, and so that does not take into effect the giant breeds who maybe I'd wait a little bit longer, but I'd be very, very careful if I don't want some of that naughty boy behavior to start.
Yeah.
So
it's an intentional choice, not a like, oops.
Yeah, exactly. Okay, so one of the other questions that came up is if there is a high rate of hip dysplasia in altered dogs. So by leaving them intact, they're less likely to get hip dysplasia. Yes, no?
There we go.
Is there any science behind this? Like, where are we at on
There
that?
is. There is some science. I mean, a lot of these things that we're thinking are caused by early sterilization, and so early sterilization is defined as under 12 months, late is over 12 months, and then usually the intact, I think the big study everybody talks about is the one that came out in 2013 from UC Davis with the golden retrievers, okay? Well, it's great. It's only 700 dogs, though. However, we do have a fantastic opportunity to compare the U.S. culture of spay, neuter, spay, neuter, spay, neuter with Europe. Okay, so they actually do have a lot of intact dogs. However, they do not have the overpopulation problem and the stray dog problem that we do. They are completely under control. There's no accidental litters. So hip dysplasia falls into the whole, hip dysplasia, cranial cruciate tears, lymphosarcoma, osteosarcoma, mast cell tumors. What am I missing? I mean, there's the list kind of is getting bigger and bigger for, okay, where are these differences and are they statistically relevant? And then we have so many breeds, right? We have so many breeds, which, they're so genetically similar, but yet we still see real predilections. There's simply not enough evidence and to really definitively say anything, okay? Statistics is statistics. You can look at a data set and say it depends what perspective you look at it, and it looks very different, okay? And so, what did you ask? Hip dysplasia. Well, I would be more concerned about the genetics and the breed.
Yeah, me too.
Totally.
That's exactly.
I would be more.
That would be the very first topic.
That'd be the first topic, not when am I going to spay or neuter. Yeah. Okay. Let's be honest. You have a little pitty mix male. I don't care when you neuter him. He's a pitty mix male. He's not getting hip dysplasia, and if he does, it is a genetic. You did not cause that by neutering
it would not have any
you
effect
did not
on it.
cause
It was gonna
that by
happen no matter
neutering
what.
him. That was his genes.
Yeah.
Right. Okay. Let's look at German Shepherds. Right. That's a breed. Oh boy. You want to talk about hip dysplasia? That's why I wouldn't just jump to when am I going to spay this dog. I look at OSA certifications, the breeder, where did they come from? What does that lineage look like?
Yeah.
Parents, grandparents, great grandparents. What do other same match litters? What did they do? That's more important.
There are a lot of other factors
than going, when do I spay my dog? Now you take a high risk dog. Right, you take a high-risk dog, like let's say a German Shepherd that you don't know the history of whatsoever. You don't even know who her mother was, right? You picked her up at the shelter. Well, if she's from a shelter, she's going to be already done. But that spaying her a little earlier might tip her over the edge. But the differences are probably so minute that it was either already there, this is a grade scale. This is not just, yes or no. Hip dysplasia is a genetic disease.
Exactly.
And so the difference of sitting down and having that debate, I have a hard time really spending a lot of time going, no, you gotta wait till, 2 years old to do this dog. And you will absolutely hear that from a lot of incredibly credible breeders, and they'll say that if you're getting your dog from a breeder, honestly, that's probably in the contract.
Yeah.
You know, if they've done their research and they know their line, right? That's just going to be in their contract, and guess what? Then you don't have to think about it. So just a thought.
And I think that there's nothing wrong with asking, seeing the documentation. If you're getting your dog from a breeder, if you want to know more about the genetic makeup, you should be asking these questions. But pulling it back down to spay or neuter is not going to be necessarily on the whole a factor in if they're going to get hip dysplasia.
Right.
Right. Yeah. It's
right.
Just,
I mean,
but ask the questions
so
of your
maybe
breeder.
2 to 6% more likely. Okay.
Maybe.
Hip dysplasia versus like a lot versus medium or a little bit, versus I don't know, breast cancer rockets up to 40%. Whoa. Okay.
Yeah. Where are you gonna
which
go?
Which one do you want to choose?
Which one do you want to choose? Yeah. Yeah. Exactly.
You know?
Okay, so another one on there has to do with females and if they'll develop any urinary incontinence if they're spay.
Good question.
Is that something that people need to be worried about?
Good question. So, spay incontinence in females. Turns out the urinary sphincter relies on estrogen for tone. I mean, I don't need to make it more complicated than that, but so when we spay them, they may develop urinary incontinence. Okay. Does it matter what age we spay them at? Not particularly. And so here's the scenarios. 8-year-old min pin. Spayed her at 8 years old, developed spay incontinence. Okay, that was an older spay. She, and then basically you just do hormonal therapy. So the vast majority of spay incontinence is solved by a simple pill every day that's relatively cheap. And it's a very common thing, okay?
Very common.
Would I ever not spay my dog to avoid the possibility of her getting spay incontinence? No, of course not. But you hear a lot of people say when you spay them young, they're more likely to get spay incontinence. Okay, well, I've seen quite a few younger dogs, so they get spayed at 5, 6 months old, 4 months maybe, and a couple months later they'll come back and go, gosh, I think she's wet in the bed. Put her on some Proin, phenylpheniramine, and it clears up. After of course we check for UTI, she doesn't have a UTI.
Sure.
Put her on some Proin. Okay, that's probably something that she will unfortunately be on for the rest of her life, right? Okay, so that's a scenario. You could also spay her at 6 months, and maybe when she's 8 years old, she develops spay incontinence. 8 years old,
so it's kind of a crapshoot.
It's a crapshoot.
It's just
It's
you
a
just
total
have no idea what
you have no idea.
Yeah.
And yes, it's true that intact females don't really get urinary incontinence. It's very low, and yes, spayed females are fairly common-ish, but it's a pill, and you don't know, if she's older and she's gonna get it, why would you wait to spay her just to, right? It goes with the whole perspective thing of if you're trying to avoid spay incontinence, you're right.
Then that means you would have to not spay the lifetime of a dog. Exactly. It has nothing to do with waiting a year's time or for the first heat cycle or any of those have no bearing on the incontinence, right? Yeah. And I had a dog, that's a question too. Does it have anything to do with, is the incontinence increased by them having a litter of puppies and then being spay? Or is it all
I don't know if there's any actual
connected?
data on that.
Yeah, I don't know either. This dog so happened to have a litter of puppies, and then she got spay, and then she had the incontinence. And she was on the one pill. It was super simple, cleared it right up. So easy peasy. And actually, I don't even know. I'd have to ask if she's even still on it.
You can actually sort of wean them off.
She might be okay. I'll have to double check and find out. But
and if you have a dog with spay incontinence and you're kind of at your max dose and oh my gosh, it's not working anymore, ask your doctor. Take them off. As soon as you put them back on, they resensitize basically. And so that's a kind of nifty little trick. Don't be afraid to ask your doctor.
Wow. Okay, that's great. And one of the final questions is, could my young dog contract an infectious disease if they're spay and neuter too young? That was a popular
kind of
infectious disease.
Like
I don't
parvo
know.
or distemper?
I don't know.
Are they worried about like,
that
the
was just a
puppy
common
things?
question that was put up there. Just an infectious disease of some kind, that there is a fear of that.
Okay. Well, I would say the biggies, parvo and distemper, proper vaccination protocol, always important. That series is going to be done by the time they're going to the vet, so I certainly understand that, you know, going to high traffic areas is a little scary, right? But if you did your vaccines with them, right, and you know, if you did your vaccines with them, then you have done your due diligence for protecting them, and that's important.
Yeah.
I mean, give yourself credit for that. You know, of course, you know, there's, you know, sterility and this and that, no cross-contamination. So I'm not really, just vaccinate.
Yeah,
just vaccinate. Like those are the scary ones. And if they're not vaccinated, you know, if they're in a controlled environment, get their vaccines at least 3 to 4 weeks apart, and then you can consider them as protected as possible. But guess what? Parvo is incredibly persistent in the environment. Just because you don't take your puppy somewhere doesn't mean you don't bring it home on your shoes, right? And so it's, you know, again, with the perspective aspect of, I understand you're careful, but technically parvo's everywhere. I mean, we get a lot of people who don't vaccinate properly, and just a few of those, combined with the fact that it lasts for years in the environment, means you go to Walmart, you're bringing it home on your shoes anyway. You know, bringing them to the vet clinic, if they're protected by their vaccines, so low risk.
Should be good. Low risk. Yeah.
Totally.
Yeah. So basically, in a nutshell, it sounds like the best alternative, or the best course of action, would be to spay and neuter your dog, but also more along the lines of where you get your information. Everybody has an opinion about something, and you could ask 10 people, they'll all have an opinion about it. But where is that opinion coming from? It doesn't mean that it's fact. And so finding out the facts and reading something on the internet does not make it true. You can find a study about anything, anywhere, proving your point. And we were just talking before we started this about, you know, these studies that have been done, and the group that they use is so small that you need to have thousands and thousands of dogs across the breeds looking at the data and seeing if there's a trend, and that hasn't been done yet. So the bottom line is that it's just not conclusive whether you should hold off spaying or neutering your dog. That is what I want to drive home, really. It's just not conclusive. You know, no matter what people tell you, it's not conclusive. But look towards a trusted advisor, your vet. Go and talk to your vet and ask what should be done and what they think the best protocol would be.
Yeah, absolutely. I mean, people, again, they hone in on these scary diseases, you know, and, you know, 4% more likely is actually not very more likely at all. And then how big is your data set? And then picture, looking at, you know, I would so much rather be spaying and neutering, you know, 5-6 month old, you know, teenagers, puppies practically, right? Give them some growth, but get them before their first heat, than, you know, a 2-year-old. And, you know, and we didn't talk about complications, like surgical complications from spaying and neutering, okay?
Yeah.
I mean, spaying and neutering is an incredibly routine procedure, but it's surgery. It's anesthesia, and it's surgery. And the reality is the complications, honestly, are basically post-op. It's not the anesthesia, you know. If there's a trust me, it's beyond my control, right? Anesthesia is, on the grand scheme of things, very safe, particularly for younger animals. Duh, right? Surgery itself, again, routine.
They bounce back so good.
When they're young, when they're 6 months old, they bounce back so fast. The 2-year-olds, they're sore for longer, they're more uncomfortable, they're more painful, they're more likely to bug their incision and get themselves infected. You know, and it's, again, that's a post-op complication, so I don't want to say complication and freak you out, you know, you got to pay attention. You really have to slow them down for a solid 10 days, you know, a lot of crate time, a lot of leash time. When they're young, you know, and something happened?
Yep.
It's so easy.
Yeah, it's super
and I
easy.
think that is, you know, it's weird to me. I mean, this is a topic in the veterinary field, right? There are clinics that will recommend all dogs 1.5 years old. You know, their post-op checks, you know, and their seromas and their infections has nothing to do with the surgery itself. It's more the animal's bigger. Yeah, it's the aftercare, and the animal's bigger and they're more uncomfortable. And so those are some of it's something to consider, right? It's all first to consider. But anyway,
it's quite easy when they're young.
Yeah,
so
it is so much easier, and they're awesome. They're like, oh, whatever.
Yeah, they heal so fast. So,
and we even do them. I mean, I actually do them at 10 weeks. I mean, in the shelter community.
Yeah, in the shelter environment.
That's not wrong.
Being adopted out, and again, it goes back to the overpopulation and trying to control that and prevent that from happening.
Absolutely.
So anyway, well, I just want to thank you so much about coming to the table with beer and talking about this, because it's a conversation that comes up every week for me with clients that are calling and asking, or my dog hasn't, and I don't know what to do, and should I, and my family said that I shouldn't or should, and so it's like I just wanted to put the information out here. So
and now I get to, when people ask me, I can say
here's a video,
here's
a discussion
more valuable to you than my next 5 minutes of
yeah, absolutely. And also a huge congratulations on your anniversary.
Oh, thank you.
Because she's providing this service in our community for spaying and neutering at low cost. So it's accessible for everyone.
Yeah.
Everyone should be able to spay and neuter their animals.
Yeah.
And so you're providing that. It was a great need in our community, and you just plugged yourself right in and did it. So congratulations.
Thank you.
And especially too, kudos for being a woman entrepreneur. I'm all about the women doing their things.
It was jumping off a cliff. It was insane.
Every time it's jumping off, everyone starting a business had to jump off that cliff.
Yep.
Yeah, but you soared.
Oh,
and
totally.
You had to.
We have our open house on the 15th. Total just party all day, basically. Bouncy castle, whatever.
She'll celebrate.
Probably link. And it's just a thank you, customer appreciation. Just a thank you to everybody. I have no idea how many people are going to come up to that, because we have literally done thousands of animals in our community in Northeast Washington, North Idaho, helping rescues decrease their duration of stay.
Yeah, it's been wonderful.
We basically just got creative and got ambitious, and it's really the community that made us successful.
Right.
So
it was a need that needed to be filled. Yeah, absolutely.
We need to keep that momentum going.
Yeah.
Scraps has done a great job. Humane Society's, everybody involved. Pet Savers, everybody's done a great job, and we just need to keep going, because
and Bob Barker would be very, very proud. Spay and neuter your pets.
Totally.
So, all right, with that, we are signing off. I hope you have a wonderful day. Just know that you are loved, and be very good to yourself. Bye-bye.
Thanks. Bye.